Hi, this is Dr. David Klein with Stages of Life Medical Institute. Thank you for tuning in. You're going to love this one. What I'd like you to start doing now, we're probably going to be freeing up a lot of people to return to work sometime around, let's say Easter. At least the president says that, and I do believe he's probably correct. But understand that the United States is a big country. We have states that are warm temperature-wise, and we have states that are cold temperature-wise. It is not a huge stretch of the imagination to see the net effect of what ambient temperature does to this type of infection. It follows influenza pattern. Now, what does this mean? It means that in Florida, where we're sitting right now, it's 95 degrees outside. We are going to see a decrease in the number of cases here. We're up in New York, where it's still very cold relative to the virus. They're not going to see much of a change in terms of the number of patients until May. So we're going to be open for business here in Florida before New York is, and the country has to be run that way. But where is this virus going? Is it just packing up and leaving? The answer is no. It's heading south of the equator. So it's going into the southern hemisphere, which, by the way, is now moving into the fall season, which is their flu season. So we're going to start to see things happen in South Africa. We're going to see them happen in Australia. God bless them with their fires. We're going to start seeing it in South America. That's just the way these things are going to happen. When is that going to happen? It's happening now. Wait a second here. So when it passes there, where does it head to? The same thing migratory birds do. It's going to head north of the equator. So when can we expect our new friend, COVID-19, to return? It's going to come back as COVID-20. Okay, we're going to see it in September. See you in September. All right? Now, understand that different populations, different cultures, different temperatures are going to influence the penetration rate. So there are things that we need to do. Number one is expect a pandemic south of the equator and then anticipate the return in September. There are things I'm going to want you to do in the meantime. Business is going to return to normal in Florida next month. Prepare for September. This is what I want you to do. I'd like you to make sure that you have enough colostrum, lactoferrin-containing colostrum, licorice root extract, which is taken only if you get sick, and then you need to make your body's immune system work a little bit better, and you can do this with a chelated mineral mix. The one we prefer is called Magic Minerals. You can try cobbling it together yourself. That's fine. But you need to do this because you don't want to wait until you get sick to treat it. This is not a common cold. This is not a regular influenza. This is something that can put you out of work or at worst kill you. Thank you. I'm Dr. David Klein with Stages of Life Medical Institute. We'll be coming back and giving you even more. Thanks.